Hi, I'm Dr. Peter Coleman. I'm a retired physician and a board-certified addiction medicine specialist. And I had over 40 years of experience with my own recovery and working with patients who have addiction problems, particularly opioid use disorder. And today we're going to be talking about how addiction actually develops. And we're going to be using the brain bucket model, which I love. So the brain bucket model basically says that our brain is like a bucket, and when it gets filled, it overflows, and that's addiction. And what does it get filled with? Well, three things. The first is genetics. So people are born with genetics for addiction. The second is trauma, which we've talked about both of those in the last couple of videos. And the third is the actual drug use itself. You need all three. There are some people who just have incredibly high genetics. I was working with a patient a while ago, and both mother and father were alcoholics, and this poor kid started drinking and using drugs at age 16 and 17, and by age 22, he'd already been in rehab twice. He'd already had 2 DUIs, car accidents, falls, fights and arguments, and just a severe, horrible disease at such an early age. Some people have enormous amount of childhood trauma, and that fills their bucket up and gets them close to the top. And so then it doesn't take much drug use to overflow it and for the addiction to develop. What actually happens when the brain bucket overflows is that an addiction has developed. And what does that process actually happen? Well, it's a fairly predictable cascade of events. The first is a high dopamine spike in the reward system. And so drugs of abuse, all drugs of abuse, release way more dopamine than nature ever intended us to get. Through our natural rewards of food and sex, drugs overpower that and give us a much stronger effect. Messages immediately go to the prefrontal cortex that evaluates how good that effect was and how good that dopamine felt. And we make a decision to do it more now and in the future. We immediately send messages to the memory circuits that basically say, let's remember this, and that creates the memories and the associated memories causing the triggers, which then actually release dopamine in the future and cause people to keep using and to relapse even if they're trying to quit. It also sends messages to the emotion circuits where we fall in love with the drugs and we start overlooking all the negatives and the red flags that say this isn't actually probably good for us. We say, oh, it's not that bad, and I don't want to quit now. I keep going. Once those processes are going, we start thinking about our life differently. We start associating with different people. We start engaging in other activities, and those things take on a life of their own. Because as we do more and more things, then brain circuits become more entrenched and our whole life starts changing so that the brain starts changing and getting injured. The more this goes on, the deeper those pathways go, the more we get caught up in the whole drug-using lifestyle, the more we start seeing that as normal, the more we start losing those other brain circuits that say life could be good, it could be different if we just do things differently. And so this whole cascade just keeps going and going until it's time to stop. And for some people, it's usually some kind of major event like a drug overdose or a jail time or something like that. But it generally needs something to pitch us out of this situation. So that's the way the disease develops. We have genetics that set us up, we have trauma that adds to it, and then the drug use itself overflows the bucket and starts causing these changes, what I call injuries to the brain. So we can think of the brain, of the disease of addiction as a brain injury. Fortunately, the injuries will heal over time. Those pathways will get less and less important, and the triggers will get less and less powerful. The emotions will get more and more calmed down. Although we will remain vulnerable to relapse if we start doing bad behaviors or not paying close attention to our recovery.